Hello friends, I know we spoke about polynucleotides in the previous video, however, I feel like there's more to say here. This was partly sparked because I just came back from the AMWC conference in Kyoto, and one of the most interesting lectures that I saw there was on Rejuran, which is a sort of polynucleotide. You may recall in the previous video we spoke about nucleophil, which is a polynucleotide. Rejuran is the most popular polynucleotide in Korea, and those Koreans know a thing or two about skin rejuvenation. Rejuran is a polydeoxyribonucleotide. So polynucleotide is a sort of catch-all term for any type of polynucleotide, whereas PDRN refers to this specific molecule. A PDRN will be between 50 and 1,500 kilodaltons, whereas a PN will be longer than that. It's said that because of the shape, the PN is a bit more water-loving also than the PDRN. I don't know clinically how this plays out because I have not tried the Rejuran yet. We don't have it over here, but the manufacturers are going to be sending me some to try, so I shall keep you updated. Most of the literature around this topic is actually pertaining to PDRN, not PN. Someone asked me recently whether or not these products were vegan or cruelty-free. The products used in aesthetics are not vegan, so they are derived from either salmon or trout. Products not used in aesthetics can be chemically synthesized or from bacteria in the same way that hyaluronic acid is produced by bacteria. I did ask the manufacturers of Rejuran whether or not their product could be described as cruelty-free. So it's sourced from wild fish who apparently land somewhere near their manufacturing plant on their life cycle and spawn somewhere near there. So they're not actually captured and killed to produce the polynucleotide. They just harvest it locally, is my understanding. I would imagine it's probably cheaper for them to do it this way, otherwise they would have done it in the same way as the hyaluronic acid is produced. Who knows? You may ask why I have decided to come back to this topic. Well, one of the things that really struck me when I was in Japan was how they are using the PDRNs. There's been a recent new protocol come out for Profilo, which involves injection of the product, not superficially, just under the dermis of the skin, as we have been doing for many years now. Rather, the product is injected in specific areas near ligaments to provide a more lifting effect. And this is because although Profilo has been traditionally touted as more of a skin hydrator, the company are pivoting that into a true biostimulator. So what they're saying is that by injecting the Profilo locally next to these ligaments, you will get a lifting effect due to its biostimulatory effect on those local cells. And there was a similar protocol presented in Japan. One of the things that we experience in aesthetic medicine is this constant sort of push-pull with patients who don't want to have a dermal filler injected for various reasons. You know, maybe they are worried about the aesthetic outcome, or perhaps they're worried about any potential complications or side effects. And as I said in my previous video, sometimes there is volume loss and you just have to fill it, and there's not much that you can do about it. So with this new protocol, I would say that that was still true. However, this offers you the opportunity, if you have mild to moderate signs of aging, that you can have a different product injected, either something like the Rejuran or a regular PN or something like Profilo into these areas, which will give you more of a lifting effect. What's interesting is these zones do somewhat correspond to Mauricio De Maio's points that he recommended for injection in his 8-point lift several years ago, and then this was further refined in his MD codes. Many people think that It's a very reductive way of injecting hyaluronic acid fillers, but of course you don't inject every single one of those points in every single patient. Of course, you use your eyes, and as my dad would say, your loaf, which means your brain, and you see which area that individual has volume loss in, and if they have volume loss, you inject it. It's not rocket science. The first one is the orbital retaining ligament. This one's an interesting one actually because it doesn't correspond exactly to the point on the 8-point lift. However, it does correspond to points on the MD code, so it is a bit more of an advanced technique if you are going to do hyaluronic acid filler there. 2 and 3 are the zygomatic retaining ligament, and these would correspond to points on the 8-point lift and MD codes. And point 4 is the buccal maxillary ligament, and you're treating the base of this. This, I think, is in the nasolabial codes. It looks to me like they're indicating NL2. Number 5, the mandibular retaining ligament, again, is not in the 8-point lift, but it is in the MD codes. And this would be C3. Number 6, the mesenteric cutaneous ligament, is again in both. And number 7, the orbicularis ligament, is in both. For those worried about vascular occlusion when you're trying to get this into the right spot, no need. When I was at the conference, they showed a study of, admittedly very small study, of 2 rabbit ears which had been injected intravascularly with the Rejuran, and at 3 days and 3 weeks they had no signs of vascular compromise in comparison to a cross-linked hyaluronic acid. I can't find the original paper. I have tried. One of the things that I wanted to talk about with a more superficial injection, and this is not necessarily just with Rejuran, it's any kind of skin improving product, whether that be a PN, PDRN, HA, whatever it is that you can inject more superficially, is the retinacula cutis. So I'm sure that you're familiar with the work around how the shape of the skull changes with age, and also the change in the fat compartments of the face. Just as a refresher, here are some images. As you can see here, this is an illustration of the change in the shape of the orbit with age, and here we have the change in the piriform angle and the maxillary angle with age. This is one of my favourites. When you inject the base of the nose, it does give you a really nice rejuvenating effect. People often don't understand why I suggest that, but here we are. This handy illustration shows the amount of resorption which correlates to the size of the arrow. This is really one of the things that we're trying to treat when we use dermal fillers. We're looking at where you have lost the bone and adding this jelly into that area to try to disguise the fact that you have lost the bone in that area. The other thing is the fat. So the fat is divided up into the superficial and deep fat compartments very, very broadly. And it used to be thought that these fat compartments were just basically like a big amorphous mass, but they're not. They're separated into small, discrete compartments, as you can see on this image here. In general, it's thought that the deeper fat compartments will atrophy, whereas the more superficial compartments will change position or actually get bigger, although atrophy has been noted in the forehead and around the eye. Oh, and around the mouth as well. I like to just briefly talk about the retinacula cutis, which is the area between the smas and the dermis. I always thought it was a bit weird that the loss of elasticity in the skin was blamed as a primary cause of facial sagging, where in most areas the facial skin is only about 2 millimeters thick, so how does that make any sense? This stuff, the retinacula cutis, has this massive role to play in structural maintenance. And this is one of the areas that we're actually targeting when we do a treatment, more superficially that is, using a product with a PN or, whatever. Take a look at this MRI where it compares mild sagging with more severe sagging, and the red area here depicts the retinacula cutis. You can see in the severe sagging there is much less. Okay, so you inject this stuff, whether it be close to a ligament or to stimulate retinacula cutis, or maybe you're doing something like Sunakos and you're improving the dermo-epidermal junction. What are you really doing when you do that? So it's all about this concept of biotensegrity. which I had not heard of until I was in Japan recently. So the concept behind this is everything's linked together from the epidermis to the bone. And these cells are all cross-talking to each other. And it's a model of how the cell and the organism on a more macro scale can adapt to deformations mechanically or biomechanically and survive. It's been spoken about in the context of oncology, mainly about the extracellular matrix, and it just so happens that PNs and PDRNs have a role in the production of extracellular matrix. If you recall, in the last video, we spoke about how polynucleotides can stimulate extracellular matrix production through action of the A2A receptor. What does that mean? Well, it's good for your biotensegrity. So basically, when you push your skin, it goes back to how it was before, makes it more elastic. Alright, so that's it for today. Let me know in the comment section what big words you learnt today. Biotensegrity is one, of course. And I'd also be interested to know what kind of videos you want me to make in the future. I have a feeling it's going to be like, oh, just put 20 mils in this guy, please. Is that the case? Let me know.
I asked the manufacturers at Rejuran what their source was, and they advised that these fish, they come to spawn near the factory. So basically they come, they do their business, and then they're going to die anyway. So they then harvest the fish and take the gonads from the fish. So if I was a fish and I'd spent all that time getting from A to B so that I could have more baby fish, I'd be pretty annoyed if someone prevented me from doing that. But they don't do that. They actually let them spawn, and then they take the fish that were going to die anyway. So I guess that makes it better, maybe.